conference. Dr. Samay, please.
Good morning and good afternoon for the team from Thailand. Distinguished guests, ladies and gentlemen, on behalf of the Department of Mental Health, which has a mission to become a center for mental health learning and training center in ASEAN and international level. As always, we improve and adjust our work to proactively respond to the challenges into the new government management system or new normal in many forms in order to respond to the behavior of individual of Thai society and international. In addition, we develop the mental health policies, public awareness, solving mental health problems, and efficient management system and good governance. The Department of Mental Health have operated on discussion and exchanges, as well as disseminated academic work or an effective developmental work model with the foreign country. In particular, the country cooperative networks of the Department of Mental Health share and exchange the knowledge, also transfers to the operators and apply to suit the contract in their area. So, not only reading the well-being of Thai people, but also being a mental health leader. The International Mental Health Virtual Conference on topic Digital Mental Health Service tool for improving services quality. This conference will not be possible without cooperation from the UK Embassy in Thailand and the Prosperity Fund Thailand, as well as the international network of the Department of Mental Health Taiwan. In this occasion, I would like to open the International Mental Health Virtual Conference on topic Digital Mental Health Service tool for improving service quality. Thank you.
Thank you very much for your special speech to open the International Mental Health Virtual Conference. In this occasion, I would like to introduce Mr. Steve Appleton, Global Mental Health Consultant, Associate of the Center of Mental Health, the United Kingdom, as the moderator of Digital Mental Health Service tool for improving services quality section. Mr. Steve, please.
Good afternoon, everybody, distinguished guests and participants from Thailand, also colleagues from here in the United Kingdom, and I think a number of other countries today, including Malaysia and also Cambodia, that I've seen pop up in the chat already. I'm delighted to join you from a very dark and wet United Kingdom this morning. I hope it's a brighter day with you in Thailand for this very important and exciting event. Look at the future of digital mental health in Thailand. We have some fantastic presentations and speakers for you throughout this session today, and there'll be an opportunity towards the end for you to ask questions and enter into a discussion together. In terms of some housekeeping rules, if you're not speaking, then please could you ensure that your microphone is muted so that we don't get unnecessary feedback across the broadcast. If you have, as I say, any questions that you want to ask, please put them in the chat and we'll do our best to collate those and bring them together towards the end. So what I'd like to do, if I may, is to start the proceedings today by presenting to you some work that I have been leading with my colleague, Sarah Hughes, to look at the potential for a vision for digital mental health in Thailand. This work has been supported by our colleagues in the UK government, and I should particularly also thank a number of other people, including Christopher Exeter, who is with us today, who helped to put this work together. And we've been delighted to work with colleagues at the British Embassy who helped us to make contact with a number of people who wanted to speak to as part of this work. So let me take you through the work that we've done and some of the findings that we have. Could I have the next slide, please? So as you will all be only too well aware, mental health in Thailand has been an issue of growing focus over recent years. And that's a trend that we've seen not just in Asia, but also obviously here in Europe and around the world. The importance of good mental health and the importance of investment in mental health services around the world has for some time become a much more important issue that's been much more out in the open than it has been in the past. Similarly, I think in Thailand, what we've seen is a process of development and transformation of services, which has been underway for some time. That accords similarly with work that's happening in Europe and the United States, also in Australasia, where we have moved much more towards the community-based model of service provision, moving away from more traditional and legacy provision, which was focused around hospitals and inpatient care. And I know that in Thailand, a huge amount of work is happening to move forward that community transformation. But alongside that community transformation, Thailand has already begun the development of digital mental health services, and you're going to be fortunate enough to hear later on from colleagues who've been involved directly in the development of those services. But just quickly, they include things like telepsychiatry, online depression screening tools, and a range of developments associated with different apps for phones and tablets and mobile devices. All of those you will hear a little bit more about later on, and we'll touch on some of those in this presentation. Next slide, please. Just for those of you who, unfortunately, like me, have not been fortunate to visit Thailand, just some little facts, I think, that may be helpful to set in context the position within Thailand as a country. So the population is in the region of 69 million people, and around half of those people live in urban areas. And that's important in terms of the reach of services, both real or electronically based. It's estimated that around 3 million people in the country live with poor mental health. And in 2018, which is the period for which we were able to get data, there were 4,234 deaths by suicide. That is a pretty striking number, and that equates to around 10 deaths every single day. Now, obviously, in the context of the coronavirus pandemic and the number of deaths that we're seeing, certainly here in the United Kingdom on a daily basis, it may not seem that many, but actually it is a significant number. Added to that, more than 50,000 people attempted to end their own lives in Thailand in 2018. And that's around 6 people attempting to end their own lives every hour of every day. So it's a very, very challenging and serious suicide is the second most common cause of death in Thailand after cardiovascular diseases. And you can see from the last point there that the suicide hotline that has been run by the Thai government received 800,000 calls in 2018. And the Samaritans in Thailand had 10,000 calls in the year 2019. So there is a significant demand for help and support, but there's also a challenge there in terms of the impact of suicide, both on services, but most importantly on families and others affected through bereavement by those of those who end their own lives. Next slide, please. So in terms of the context for the work that we've undertaken, and I'll say a little bit more about the Centre for Mental Health in a moment, during last year, the Thai Mental Health Department worked with the Centre to consider a number of issues that related to digital mental health. And that was a relatively wide-ranging piece of work, but it did focus down on the impact of social media, and in particular, thinking about the role that social media has to play both in promoting good mental health, but also the more negative effects that it might have on people's mental health through online bullying and trolling, but also the spreading of misinformation through social media channels. It also looked at the ways in which service delivery could be done more effectively through digital platforms and where there would potential for further development. And it's on that basis that this project was then commissioned. And it's been a continuation of a collaboration that has been in place between the Thai government and the Centre for Mental Health and the UK government over the last year or so. And it builds upon a range of other work that the UK government is currently doing in collaborating principally for us anyway with the Department for International Trade, and you'll hear a little bit more about that when Dr. Exeter speaks later. So just to say a little bit about the Centre for Mental Health before I move on. The Centre for Mental Health is a national charitable organisation based in London, but operates both nationally across the UK, but also obviously internationally. Been around for a number of years. Its work focuses on trying to undertake research and evaluation, but also to influence and develop thinking around policy in relation to mental health. Its chief executive is Sarah Hughes, who's been with the Centre for about 3 years. Sarah has extensive experience of working in voluntary sector organisations, but also within local government. She has contributed to a range of initiatives and developments that have influenced UK mental health policy. She's particularly worked recently in relation to issues on inequality and race, and she's part of the CIA International Health Leaders Network and a key contributor to a range of other work that takes place on global mental health. I work independently as a consultant, but I'm an associate of the Centre for Mental Health, and I'm also the European lead for the International Initiative for Mental Health Leadership, which works to advance knowledge exchange and leadership development in mental health services across 9 countries around the world, and England is a member of that network. So we're trying to bring a bit of an international focus to this, thinking about what's happening in Thailand, but also where there might be examples that we could learn from that would help the country in its development of digital mental health. Next slide, please. So this work has involved a short and targeted process. It's been a consultative process in order to review the issues in relation to digital mental health. And we had really 3 main aims that we wanted to try and achieve within that work. We wanted to look at current developments, and as I say, you'll hear a little bit more about some of those later on. We wanted to look at international good practice, and then we wanted to consider what a vision for digital mental health ought to include if Thailand were to take that idea forward. And we wanted also to look at the current landscape in relation to digital mental health in Thailand more broadly. So what else is out there, what's happening across the country, and in a sense, to try and gauge the appetite for the development of digital mental health more broadly. Excuse me. So this presentation provides a summary of the main themes to emerge from that, and it outlines the recommendations that we've put into our report, a series of suggestions for consideration going forward. Next slide, please. So I guess as we're all only too well aware, given that there are people from a number of countries joining this workshop today using online technology. We know that technology affects almost every aspect of our daily lives. We can't really remove ourselves from it. The emergence and growth of digital mental health has been described by many people as the next revolution in the approach to delivering services. And that's a fairly lofty and aspirational statement, I think, but nonetheless, I think we are seeing the growth of digital mental health services, not just in Thailand, but in many other countries. And in the context of a pandemic, we're seeing that growth accelerate. There are some challenges, of course, as digital mental health services begin to emerge. And we know that the nature of mental health problems themselves is that they're dynamic. And that unlike lots of other areas of healthcare, providing a diagnosis and treating mental health conditions is not always straightforward. There are a whole range of issues to think about, and there are a number of different factors which can impact upon a person's mental health. For example, their housing, their employment, their access to public transportation, their income security and their food security. So it's not just a simple biological issue. The social determinants of people's mental health are significant. And there are inherent challenges in trying to utilize the opportunities that digital mental health interventions can bring. And so I think there is a sense around the world that their implementation requires very careful planning and consideration. It's something that needs to be done with great thought and care as we move forward, to think about the ways in which the technology can help, but also be aware of the ways in which it can hinder too. Next slide, please. So just a few facts really about digital access in Thailand. Some of this you may already know, but in 2019, approximately 50 million people in Thailand had access to the internet. So that's a pretty large number. And that figure is projected to grow to around 61 million by the year 2025, so not too far away. In 2020, the number of smartphone users in Thailand was estimated to be around 52.7 million people, which is a pretty significant number, and that number has been rapidly rising since 2015. And I think that probably mirrors the experience in a number of other countries, not just in your part of the world, but also here in Europe and in America and Australasia. The kind of emergence of smartphones over the last decade and their growth has really changed the way we access information and how we communicate with each other. And therefore, it was probably very, very likely that they were going to have an impact on the way in which we deliver mental health services, how we communicate about mental health in good ways, and perhaps also, as mentioned earlier, not always in such good ways too. Next slide, please. The expanding market for mental health apps on smartphones have a really tangible example of transformation taking place in digital mental health. And I think many people regard it as an example of a public appetite for more data-driven digital mental health support. I think that part of that appears to be about internet access. People can log in now and look at their own home, they're sitting down in the living room. They don't have to travel anywhere. It's easily available, often at very low cost. It's also very anonymous. So that's also the reason why apps are particularly attractive to people. However, there are gaps in the evidence around their effectiveness, and I won't go into detail on that. There's a lot of material that's available in relation to studies that have been undertaken around the world in terms of the effectiveness of different mental health apps. But there are now around upwards of 10,000 apps available to download. So there's a huge amount of choice and diversity. Increasingly, the public will want to use digital technology, and talk about some of the ways, some of the reasons why that was the case. But they want to use that technology to engage with services in different ways. So not just to be actively receiving, but to engaging with clinicians, therapists and other specialists and different organisations so that they can receive services digitally, but also to make use of the information and the data that's available to understand and better manage their conditions. So the development of digital mental health interventions has been prompted and in some cases accelerated by very specific circumstances. And we're all only too well aware that the emergence of the coronavirus pandemic has really seen a big shift in a move to digital options. Obviously, the emergence of the virus has meant that for many people it's not been possible to meet in person. And where they have been able to do that, it's obviously been at distance. So it's been a much more difficult period for the delivery of face-to-face real-time services. So it's seen a big shift to more digital options. As you'll see there, the World Health Organization did a survey of around 130 countries, and about 70% of them had adopted telemedicine or teletherapy to overcome the disruption to in-person services as the pandemic began to spread. But what that survey did show was some significant disparities in the uptake of those interventions among those different countries. And more than 80% of the high-income countries reported that they had deployed telemedicine and teletherapy to bridge gaps in mental health. But that compared with less than 50% of low-income countries being able to do that. So I think what you see there is a very significant accessibility and equality gap in terms of the availability of those services, both in terms of providing them as well as people accessing them in different parts of the world. Excuse me. And I don't think that we'll see any reining back on this development, although as we all hope that vaccinations roll out in different countries all at different paces, but that the world returns to a slightly more normal way of working that we're used to, although it will still be different. Actually, the appetite for digital mental health and the ways in which it can be helpful are likely to stay with us as we move forward. So as you'll hear later, Thailand has worked to develop telepsychiatry services since 2005. So there's a reasonable history of trying to develop new ways of working. Most of those developments have been led and supported by our friends at the Department of Mental Health in collaboration with a number of the different hospitals in different parts of Thailand. And the development of digital mental health services was part of the Thailand 4.0 plan, which was intended to increase access to digital healthcare and was set out in the e-health strategy that covered the period 2017 to 2026. So it still has a reasonable amount of time still to run in terms of strategic implementation. And that document was produced by the Ministry of Public Health. There are a number of different examples of individual hospitals in Thailand developing and implementing telehealth. Next slide, please. So thinking about telepsychiatry, the primary objective of telepsychiatry development has been to try to improve and expand accessibility to services and to tackle and reduce waiting time. In this COVID-19 pandemic period, it's also provided a means by which to provide services without the need for face-to-face consultation, which, as we mentioned earlier on, is a key element in some of the growth of these approaches. But clearly, this has been happening for some time in Thailand. And I think, interestingly, what we also heard about was how telepsychiatry has been developed for use within the prison service. Really interesting initiative, which you may hear more about later on. There's also been the development of a tool for the screening of depression that can take place online and through your mobile tablet. A really interesting way of trying to screen people for depression, so a preventative approach, as well as identifying people who might benefit from treatment. There's also a huge amount of work happening that's about not only tackling the symptoms of depression, but also trying to improve awareness of depression and depressive disorders, and trying to reduce the stigma that's associated not just with depression, but also with mental health problems more broadly, through improved education, and also to reduce the progression to depressive illness in those who might be at risk. And for those who do become unwell with depression, the screening tool and the subsequent work that's undertaken through that mobile service is about reducing the length of depressive episodes, and importantly, given the figures I was describing earlier on, aiming to prevent, or at very least to reduce, the incidence of suicide within Thailand as a whole. So in the voluntary sector in Thailand, there's also digital development taking place. In particular, the Samaritans in Thailand are providing digital support, and they are a significant provider of mental health advice and support across the country. Many of you will know of their work, I'm sure. But interestingly, they've been innovative and proactive and created partnerships both with Facebook and with Twitter. And the beauty of those partnerships is that they enable users to seek support using those online messengers and direct message services within the two social media platforms. That's enabling the Samaritans to ensure that a wider range of people can be reached. A wider range of people are aware of their service, because obviously they're presenting their service within both those platforms. But also it means that people can contact them directly. They don't need to use a specific phone number. They can send a message at any time. The team within the Samaritans have 15 volunteers who are particularly focused on responding to those messages via social media. And they're specifically trained in responding to those messages. And they monitor those feeds, they get alerts, and they're able to communicate with people using those direct message services. Sometimes that moves to telephone support too, but certainly the first contact is often through those direct services, which is a new way of working for the Samaritans. They have around 40,000 followers on Facebook, the majority of whom are based in Thailand, around 3,000 on Twitter, and that's a more recent development for them. So they're hoping to grow their followership. And they're about to enter into a similar relationship with TikTok. So you can see that social media is a really important part of the development. And as referenced in earlier work by the centre, there's a balance to be struck in terms of how that can work effectively. But nonetheless, that work by the Samaritans feels particularly innovative. We also had some interesting examples of commercial sector development, one in particular called Oka, which has been developed pretty much in response to some personal experience of mental health issues. The young lady who developed the app and the service had her own experiences of trying to access services and felt that that could be better than it was for her. So she went ahead and developed an app. It now has 80,000 registered users. People can arrange for an anonymous professional consultation with a psychiatrist or a psychologist. And those sessions are paid for on an hourly basis, and you can see the approximated cost. This is an emerging commercial development. I think it's attracted quite a lot of attention from the technology media. I'm aware that colleagues across the country are in contact with the lady that's developed the service. They're wanting to promote, or she is wanting to promote, its range of services to build up a wider user base. I think it's important to say there are other services of that type that are developing commercially across Thailand and in other countries for that matter. But I think what it does is demonstrate that there are entrepreneurs, some of whom who have lived experience of mental health problems, who are keen to move into this space. So turning then to international practice that we've identified that may be helpful to draw upon, thinking about service provision. In the UK, In particular, the Kooth online counselling service, which has been developed, which is targeted at children and young people, is a really interesting model. It's grown up exponentially over a number of years. First online digital mental health company to float on the London Stock Exchange, in fact, interestingly enough. So it's experiencing significant growth, really attractive site, really easy to access, and particularly the elements for children and young people, I think, are what make it so attractive for them. It's so much focused on their needs. You'll also, I'm sure, be aware of the improving access to psychological therapies development here in England. That's about improving the provision of psychological therapies overall, but in particular, trying to move some of that work online and doing it either through video conferencing or telephone support. And through the pandemic period, the growth of psychological therapy being available online has been significant. In Australia, many of you will be familiar with Beyond Blue, which is an information and support service. It provides a whole range of information about public mental health, and it puts that online on its website, which is very easily accessible and very easy to navigate. But also they provide online counselling and crisis response services. And within that service is a kind of sub-organisation called Affinity. And within Affinity, they're undertaking the first trial to assess how best to integrate face-to-face and online mental health services in young people who experience suicidal ideation. And this is a really interesting and important study, I think, because it will hopefully be able to give us some clues about how you strike the right balance between the provision of digital mental health services and face-to-face services. In terms of the frameworks around digital mental health, there are a couple of good examples of international good practice. In Australia, the National Safety and Quality for Digital Mental Health Standards were recently published. In fact, they only came out at the end of November last year. It's a very new document, but it aims to improve the quality of digital mental health service provision and to protect service users and their support people from harm. Really interesting document, which in our report, there's a link to the document, and we describe in a little bit more detail some of the particular measures and standards that they set out. So we very much recommend taking a look at that. In terms of what's been happening in New Zealand, there's a digital health strategic framework, and that is intended to guide the use of digital technology and data, and it supports a strong and equitable public health and disability system. And it consists of a suite of what they describe as aspirational goals, but they're goals that are about enabling priorities, and the guidelines and resources are going to evolve over time. So again, they're relatively new, and much of this is embryonic for people, but those guidelines and resources will evolve over time, and they'll do so in response to the way in which digital mental health services change themselves. Next slide. So thinking about the key messages from our consultation, I think that what we heard was a very strong appetite for the development of digital mental health services in Thailand. People were enthused about this work. They were excited about the potential that digital mental health could bring, and felt that it was important that Thailand as a country should push forward with further development in the coming years. We also found that the pandemic has led to a switch in the greater use of digital mental health, and that can be achieved with quite a degree of speed, in fact. But there is still some work to do to embed a sustainable and structured approach to future development. So there's still work to do in terms of how that's all going to shake out in terms of what things will look like, but the switch has already happened. So we may have already performed the pivot, as they say, but there's a lot more work to do to think about how you sustain that switch, and as mentioned earlier on, how it matches up with in-person provision as well. There is, I think, rightly some caution about efficacy and effectiveness, but also cost and the potential distraction from issues relating to current services. So there is some concern amongst those people that we spoke to that what's this going to cost? How do we know it's going to be effective? And actually, we have a range of other issues that we need to deal with, and we need to have our focus on those as well. And I think within that framework, clearly, there are always many different priorities and things to do, but I think it's an important cautionary note to think about how we strike the right balance in terms of our strategic development. There's some skepticism and resistance to the development of digital mental health. I think that we felt that in terms of some professionals being a bit resistant and feeling that actually face-to-face and more traditional methods have been around for a long time, so why would we need to change them? But it's also the sense that there might be older generations of the public might be resistant to the use of new digital models. And throughout this, we've talked quite a lot about young people and their ability to embrace and use digital mental health technology. I think it remains to be seen whether the skepticism about older people accessing digital mental health is borne out. I think that certainly here in Europe, and indeed my own experience is that older people are able to use these sorts of platforms, and actually the pandemic has meant that actually many older people have become at least as familiar as the rest of us with the use of Zoom and other online communication tools. So let's hope that that's not the case. But there is a degree of skepticism to be overcome. But despite that, I think there is a real sense of ambition. We certainly heard that from the people that we spoke to as part of this work. A real sense of ambition for digital mental health and a desire to build on the steps that have been taken so far, because there's a feeling that good foundations have been laid and there are opportunities to go further. There was a very clear sense that digital mental health cannot and should not be viewed as a universal solution, both in terms of capacity or workforce, and rather that actually it is helpful to see it as something which is complementary as an option that can increase accessibility and responsiveness, but it probably can't replace face-to-face engagement completely, nor should it. And that was a very strong message that we heard, and that also there remains a really important place for face-to-face consultation, treatment and support. And there will be occasions where there is no alternative, where perhaps people need to be admitted to hospital. You certainly can't do that virtually. Any development of digital mental health services is going to need to take account of those existing services that are already in place and to complement those. Issues that relate to the preserving of confidentiality and making online tools easy to use and tackling the accessibility challenge will all need to be addressed. So there are things like, how easy is it for people to get online? Is that because they have access to broadband technology, or maybe they don't? If they don't, is that because it doesn't exist and hasn't reached their part of the country yet? Or is it because it's not affordable to them? Also the provision of the hardware to do that. So do people have access to computers, whether they be laptops, tablets or mobile devices? So there's a whole range of issues in relation to accessibility. Within that, how do you keep data and people's information confidential and safe? But also, how do you make online tools really easy to use? Because unless you make them easy to use, people are going to find it much harder to engage with them. Next slide, please. So I've touched on some of the connectivity issues. One of the other points that we found was perhaps that people sometimes have a lack of confidence to go online. Some of that is about perhaps they haven't used it before, they're concerned about whether or not it's safe. We just mentioned some of that. So really, I think there's a sense that there's some work to do around basic digital skills. So how do we ensure that people are equipped with the skills and ability to go online if they don't already have that? So there's probably some work to do around education and awareness and skilling people up but as mentioned earlier on, there's also issues around connectivity and resourcing. So there's probably also, certainly from the people that we spoke to, a sense that there's more to do to develop the architecture and infrastructure for digital mental health. Now that extends beyond telephone and mobile apps, but also the provision of internet access, as well as the mixed economy of state and commercial provision. Because if there's an over-reliance on one or the other, you almost effectively create a monopoly. So there needs to be some sort of mixed economy in terms of that provision. Next slide, please. We mentioned a few minutes ago the quality and standards frameworks that have been developed in a couple of other countries. And there's certainly a sense of a need to consider a framework. That's been a feature of all the conversations that we were having. There was a sense that that ought to cover a range of different issues that need to be addressed for successful development and implementation of digital mental health. I think that countries like Australia and New Zealand have shown that those frameworks can provide a really solid and sound basis for the comprehensive rollout of digital mental health services. And given the wide range of technology, the proliferation of websites and apps that we've already talked about, the use and application of national standards is a really central component of successful implementation, because it helps to iron out variability, it helps to create consistent standards, it gives you a baseline or a benchmark for quality, which is really important. So the consideration of the framework was a key component of what we heard from people as we were conducting the consultation. Next slide, please. So I had a sense that the development of digital mental health services provides a really great opportunity, and it's an opportunity to be creative and to be innovative and to think about different ways in which you can deliver services, both treatment-related services, but also public mental health information and awareness. But what we did hear, and what we learned from talking to people, but also reading some of the literature, is that taking digital mental health a next step further is going to require visionary leadership, and that's likely to need to come not only from providers, but also from officials and political leaders. We need to embrace this way of working and provide clear vision about how it can be taken forward. Any development of digital mental health services obviously have to take place in the context of a wider supply chain, and that includes government and commercial organisations, but also the consideration of existing and future infrastructure, issues of governance and compliance, and issues of quality and standards that we touched on earlier on. Really importantly, I think, coming out of the consultation was a desire to understand how best to engage service users or consumers in the development of such strategies and framework, how we can use voice of lived experience to inform the development of digital mental health services. Really, really important. We're doing that already in relation to face-to-face or in-person services, and the growth of service user and peer-led services is significant. And so any development of digital mental health is going to need to take account of and engage views and experience people who have experienced mental health. So that kind of design and production process is likely to add particular value to the design and development process, and when we go digital services, meaning people much more effectively if they co-design with them and their places. So overall conclusion, I think, is that the progress has been made by that developing digital mental health outreach, but we're going to hear about some of those things later on. The ambition is very, very high. But what does emerge from this is that there isn't yet a coordinated or strategic framework for further development and implementation. There is a need to balance the provision of prevention and promotion with treatment options in the development of digital mental health. That balance will be a little unequal, probably. And also, an approach that focuses on tackling a small number of key issues through the utilisation of digital mental health is much more likely to bring sustained benefit to service users, the public and professionals, than a kind of blanket approach that tries to tackle everything. So we've set out some recommendations, suggestions for things that ought to be thought about in terms of the future vision for digital mental health in Thailand. I'll just quickly run through those for you. We have suggested that the Department of Mental Health could develop a strategic vision for the future of digital mental health services. And it's our judgment that that vision could helpfully set out a really clear rationale for the expansion of digital mental health, and that the aims and objectives of such a development that it's intended to achieve, it should contain that information. And it should also consider the level of investment that's going to be needed to develop and implement such an expansion, because it's going to cost some money to do this. As I've been just describing, our clear suggestion is that the vision would be enhanced if it were co-produced by officials in the Department of Mental Health, alongside commercial digital experts and people with lived experience of mental health problems. We think that the development of a vision should include a plan for the implementation of it, which sets out some agreed timescales and milestones. And our thinking is that it may be helpful to have some short, medium and long-term objectives that can help build momentum in the development of digital mental health in Thailand over a 2 to 5 year period. Next slide, please. We suggested that Thailand might like to consider some of the examples of good practice in innovation that we've shared in our report and with you today, and use those to inform the models and methods for digital mental health development. There will be many that will exist within Thailand itself, but we think it may be helpful to utilise the many examples from other countries. And it may be helpful to engage in some of the international network where there is knowledge and information being exchanged in relation to digital mental health. And indeed, we engage with a couple of those networks as part of this project. We're suggesting that the development of the vision could usefully seek to strike an important and appropriate balance between using platforms for raising awareness of mental health, as well as offering support, treatment and screening services. So we're suggesting that a vision could usefully set out how digital methods and models would assist in giving information about support that might be available, public health messaging, public mental health actions that can improve population mental health more broadly, as well as innovations that might improve access to services and support, both digitally and face-to-face. At the beginning of this presentation, I focused a little bit on the numbers in relation to the incidence of suicide and self-harm in Thailand. And as we reflect on those numbers and the high prevalence that they suggest, it is our thinking that the vision would really benefit from some inclusion of a specific focus on how digital mental health services could and should be used to assist in work to reduce suicide and indeed to prevent it, not least by the provision of broader routes to seek help. Now, there are a range of ways in which you might want to do that, but I think that our sense is that this is as you will all know, it's an urgent public health issue to think about how you can reduce and prevent suicide, and digital mental health options would play a really important part in that endeavour. We're suggesting that the vision will need to set out how collaboration with the commercial digital sector, mental health developers and providers will work. There are a number of obviously well-established international technology companies that are providing these sorts of services, but having said that, I think there is clearly a need to ensure that there's work alongside some specific partners. And we also suggest that there could be a clear communications plan that can convey the objectives and ambitions of the vision to the public. And the aim of that will be to help to encourage the uptake of new digital services. And I think that would be a really useful way of getting the ambition out to a much wider audience, being really clear about the communication of this approach, why it's necessary, and the benefits that it will that it will bring will be really key to ensuring that people then take up the offer of new services. Next slide, please. We've also suggested that the vision could usefully include some thinking about how the current range of services can be consolidated to avoid any duplication. So if there are a range of different things happening, we probably need to try and bring them together to avoid doing the same thing twice in different parts of the country. Alongside that strategic vision, we've also suggesting that work will be needed to develop a set of national quality standards. Again, you can draw quite easily on some of the examples that we've described in our report and presented today, but they hopefully can be developed and then applied consistently to both state and commercial digital innovation, whether that be telephone, web-based or mobile apps. And we've suggested that the vision should take account of and complement other current and emerging strategies for mental health service development in Thailand, and seeking to support initiatives and innovation where possible. There will be lots of other things that are happening, really important for them to be supported and complemented by the digital mental health offer. So that's the end of my presentation of our work. I'd like to thank you for listening. We'll have an opportunity for some questions and comments, as I say, later on during today's session. But I hope that you found that helpful. It was a short and very focused piece of work, but we hope that it's provided colleagues in the Department of Mental Health in Thailand with some useful ideas and information about how they can take forward their ambition to improve digital mental health in Thailand as a whole. We're going to move on then, and I'd like to introduce two colleagues here from the United Kingdom who have also been doing some work around digital mental health in Thailand. Firstly, Dr. Christopher Exeter, who some of you may know from previous appearance on these webinars back in the late part of last year. Christopher is an NHS advisor to the Better Health Programme with the UK Department for International Trade, and he's joined today by his colleague Richard Stubbs. Richard is the Chief Executive Officer of the Yorkshire and Humber Academic Health Science Network, which is an organisation that connects health systems, academic organisations, local authorities, the third sector and industry to facilitate change across whole health and social care economies. And he has a clear focus on spreading and adopting health innovation, increasing economic growth and improving outcomes for patients. Richard is the international lead for the AHSN network and works closely with colleagues including Christopher to support the export of UK health excellence. And Richard and Chris are going to tell us briefly about the National Health Service Ecosystem Innovation Project. Richard and Christopher, over to you.
Thank you very much, Steve, and good afternoon, everybody, and distinguished guests. On behalf of the UK government, it's a pleasure to participate in the second international conference on mental health. I'm going to quickly introduce this project that we're developing between the Department of International Trade and the Academic Health Science Networks, and this is part of the Prosperity Fund's Better Health Programme. Picking up on some of Steve's comments around the need for innovation, we want to develop a system which connects the clinical and health system needs in the partner countries that we're working with as part of the Better Health Programme with innovations arising from the NHS ecosystem. Along with supporting health system strengthening, we also hope it will be a source of mutual learning and frugal innovation across the BHP network, so the 8 countries that we're working with as part of the Better Health Programme, and also for the NHS. So we see this as an important two-way process. And as part of this, we're delighted to be working with Thailand on the first of this project, on the first phase of this project, looking specifically at mental health. And as Steve has mentioned, mental health is one of these very important non-communicable diseases, which perhaps hasn't received the attention that it should have done over the recent years, and certainly is seen as not only a consequence of COVID, but if you have one of the other non-communicable diseases, for example, diabetes, cancer, diabetes, then you are far likely high risk of suffering from mental health. So at DIT, we're working with the National Health Service's Academic Health Science Networks on this project. And the idea will be, we will produce a report, and we will produce a set of innovations that are arising from the NHS that could help support the work in Thailand and also other countries. And we will present this at a future meeting later on this year. So to describe more about the methodology of the programme and the next steps, I'm delighted to hand over to my colleague Richard Stubbs, as Steve mentioned, who is the Chief Executive of the Yorkshire and Humber Academic Health Science Network, to explain further about the methodology of the project, the next phases, and to give a bit more background on the AHSNs. Richard.
Chris, thank you very much, and good afternoon, everyone. It's my absolute pleasure to be here speaking to you today about digital mental health. And can I also say thank you so much to Steve for what I thought was a really illuminating presentation. And I agreed with every aspect of what Steve was talking about. And I think a lot of what I will briefly talk to you about today really resonates with the findings that Steve presented to us just a while ago. I do have a few slides, so hopefully it will be presented fantastic. Thank you very much for that. As Chris and Steve mentioned, my name is Richard Stubbs, and I'm the Chief Executive of an organisation called an Academic Health Science Network. As you can probably imagine from the title, an Academic Health Science Network is an organisation that works in the English National Healthcare Service to both support the health service, but also to work with our academic and our industrial innovation colleagues to ensure that we both identify and evaluate, but then perhaps most importantly, spread and adopt innovation into all corners of our healthcare system. Could I have the next slide, please? We have a map of England here which shows you the full coverage of the country with academic health science networks. The real power of the AHSN network is that we all work as both individual organisations, but we also come together as a national network. What this means is that we can very easily act as the entire innovation arm of the English National Healthcare Service. We are here to both support our own frontline clinicians to help to adopt and create new innovations, but we're also here to both identify and evaluate promising innovations, not just from the English healthcare system, but from around the globe. And as Chris mentioned, one of my responsibilities is as the international lead on behalf of the entire country of academic health science networks. So a lot of my work is spent working with international colleagues, governments and industrial partners to have a horizon scan about the innovations that are fantastic and transformational in their host countries, and to be able to lift those innovations and to either bring them back into the English healthcare system, or more appropriately for this conversation, to be able to reflect and export those out to other healthcare systems such as Thailand. Next slide, please. So we work across the entirety of what we call our innovation pipeline. And just to echo Steve's comments, this is not simply about identifying technology. The technology, of course, is a key enabler, and it's really important that technology is evaluated and regulated and is considered to be safe for patient use. And the academic health science networks perform all those tasks. But everything that Steve mentioned about the underpinning infrastructure of how to properly transform healthcare services is absolutely right. It's also about the underpinning standards. It's about the underpinning ability of the workforce to be able to change their clinical practice and adopt and shift towards more digital methods of service delivery. And it's also about the population culture and being able to take our patients and our citizens with us, so that as we give them new methods of being able to access healthcare, they're comfortable and confident that those methods are right for them. it's not just enough to put the technology into play. We absolutely have to ensure that that investment is going to be well received, well used, it's going to be value for money, and predominantly it's going to change the way that we deliver safe care for patients. Next slide, please. And just to, I suppose, finish the point on the Academic Health Science Network as an introduction, we are able to deliver nearly all the aspects that Steve spoke about to us just a moment ago. We work on a policy level, so we can help with that overarching strategy, but we also absolutely have a very detailed knowledge of the innovation ecosystem, and we're able to very quickly identify absolutely transformational practice happening in England, expose that to other audiences, and help with the procurement and deployment of that technology. Next slide, please. Chris has just mentioned the background to this project, excuse me, but I think one of the points that Steve mentioned is well worth coming back to, which is that around the globe, you know, it's the same in the UK as I'm sure it is in Thailand. We have all experienced a huge and accelerated shift in the pressing need to change and adapt the way that we deliver healthcare services due to COVID-19. The UK has absolutely seen that transformation over the last 9 to 10 months. The Academic Health Science Network, led by me, has been at the centre of what we call the health and care reset. Simply put, that means that we've spent the last 9 to 10 months identifying all the digital transformation that has been placed into the healthcare system at pace for the first time in its history. And we've been able to evaluate that work and understand of those rapid changes that have been forced on us by the pandemic, which of those changes have been proven through evidence to be beneficial, and which of those changes are changes that shouldn't be sustained into the future. And we see this as a real inflection point, not just for the National Healthcare Service in the UK, but for all global healthcare systems. That actually one of the effects of the pandemic will be to help us to change the notion of what healthcare delivery looks like. And of course, digital has an enormous role to play in that change. And so we have an awful lot of learning that we're very keen to bring to this project, not just in terms of our experience around digital mental health, but also around our experience of the wider systematic effects of the pandemic and how that has impacted upon both clinicians' approaches to what healthcare delivery looks like, but also, perhaps most importantly, our public and our patients' understanding of how to be more comfortable with the provision of services over digital pathways. Next slide, please. Chris has already mentioned about the project that we're very, very excited and honoured to have been asked to take part in. We will be absolutely looking through our entire pipeline of mental health innovations. Steve actually mentioned a few examples, a few fantastic examples of not just UK mental health digital innovations, but also some from a more global perspective. I'm very much looking forward to coming back to be able to present to Thailand in terms of our findings about not just a long list of innovations, but I think crucially, and this is where the strengths of the Academic Health Science Network come from, it will be about a list of prioritised and evaluated innovations that have been absolutely proven to have delivered both value for money, but perhaps most importantly, better patient outcomes through their use in healthcare systems. So the Academic Health Science Network is not a research body. We're not here to look at unproven new technologies. Our work is to identify already researched, already market-ready innovations, and to undertake what we call real-world evaluation, which is to say, in a real-life frontline care setting, do these innovations still deliver the benefits that we would expect from the investment to be made? And it's that prioritization that we believe gives us the greatest impact and the ability to filter the right innovations for the right community or country needs. Next slide, please. So in terms of our anticipated outputs and benefits, we absolutely would see a huge benefit being a greater awareness of the range and the complexity of innovations that are available globally in terms of digital mental health provision. And for me personally, I am incredibly keen to use this as an opportunity to build on the amazing relationships that are already in existence between UK government and Thai government, but also to strengthen that and to start to move towards far greater clinical frontline relationships and interactions in order to create a pipeline and a mutually beneficial exchange of ideas and innovations around digital mental health between our UK clinical teams and our Thai clinical teams. As I mentioned just before, the main output from this work, this initial piece of work, which we hope won't be the end of our involvement with Thailand, will be a report which will absolutely highlight a professional understanding of the right, filtered, prioritized, evaluated and safe digital health innovations around the mental health pathway, around all aspects of the mental health pathway, so screening, preventing and treatment. And we'll be coming back to you to present our findings later on in this year. Next slide, please. I've mentioned this already, but absolutely just to reiterate the fact that this is not just the findings from one organisation. The power of the Academic Health Science Network is that we can absolutely have a conversation with the entire NHS and our global colleagues to come back with what we believe to be an incredibly exhaustive and authoritative prioritised list of innovations for deployment in Thailand. Next slide, please. And just to conclude my presentation, we have that wealth of knowledge on not just the innovations themselves, but I think just as importantly, the spread and adoption of innovation. Our challenge here often is not about the identification of the technology. It's actually about how do you take that technology and adapt it for local use. That's as true across the English healthcare system as it will be across any healthcare system in the world. It is not possible to simply lift and shift technology from one healthcare system to another. Everything needs to be adapted to local clinical practice, local cultural norms, the digital enabling of our population, something else that Steve talked about, which I absolutely agree with, and something else that we're doing at scale across the UK, not just the digital prowess of our clinicians and our staff, but also ensuring that the population is digitally enabled to be able to access these kind of new services and ensure that we don't create new inequalities amongst our communities by having our digital services not be accessible by parts of our population. As I said, we are experts in evaluation, and we will always ensure that the innovations that we promote are evaluated in a real world setting. And we have a huge and strong track record of working in this space. We've worked in many countries over the last 7-8 years in terms of creating that bridge of innovation between the UK and the host country. I'm honoured to have been given the opportunity to speak to you today, and I'm very, very much looking forward to strengthening this partnership. Thank you.
Thank you, Richard. A really fantastic presentation and great to hear about the brilliant work that your organisation is doing. It's really impressive. And I think colleagues on this webinar have learned a huge amount, both about Academic Health Science Network, which will be helpful anyway, but more broadly around this work that you're doing. And I think it's a really good example of innovation taking place that we want to learn more about and share with each other. So thank you for that. And thanks to Christopher too for introducing it. We just have a couple of minutes before we move on to our next speaker, and there is a question. And while you're here, Richard, I wonder if given you're working on the minute, whether you'd be willing to answer it. And it's essentially a question about how the the global pandemic has put the world into a crisis where there are all sorts of disparities and inequalities, and you mentioned some of them. I've touched on some of them, but of course one of them is around the availability of financial resources, and certainly the ability of low-income countries to try to progress digital mental health. And the question is asking if there's a sense that digital mental health is too far away from reality for too many countries, and whether trying to do it at sort of limited cost is actually much more of a risk than not doing it at all, probably. So I guess that's the question.
Yeah, I think it's a very wise question, actually, Steve. So thanks for raising that one. I mean, I would start by saying that actually my experience of 20 years in the UK healthcare service is that sadly mental health, either in terms of traditional models of delivering mental health or more digital models of mental health, always is a correlation to more physical health services in any guise. And so from a mental health perspective, I think there's a question about parity of budgets. And it's a challenge, I think, that all healthcare systems face. I do actually believe, and this is an individual opinion on this, rather than backed up by science, but I do think that our experience, our global experience of the pandemic, is going to shine a new, very bright spotlight on the importance of mental health. And I think as we move from a containment period around the virus into a vaccination period, as we start to enter now, beyond the vaccination period, I think will come a much greater spotlight now on global mental health. And so I do foresee a shift in every country's understanding of the investment required in mental health. So I think from a mental health versus physical health standpoint, I think it is unfortunately always under-resourced. The question about digital mental health, though, I think is very interesting, because digital services on the whole are usually evidenced as cheaper to deploy. So I think there's a question for us here, which is that if you are going to create a world's leading mental health service from scratch, would you develop it from a traditional physical construct, or would you start digitally? I think my view is that you would now start digitally. The predominance of smartphones in particular, I think, gives us an absolute head start in terms of the capital spends that the population has already committed to do as individuals. And that spend takes pressures off government in terms of the fact that nearly every citizen has access to tools which allow our services to be delivered to them over the air. And so I think digital for me is one of the answers around under or poorly funded healthcare services. And as I said, that argument, I think, is as true in the UK as it is across other middle income countries.
Thank you, Richard, for picking up on that question. Really helpful. And as I say, thank you again to both you and Christopher for the presentation of the work that you're doing. I think we're largely on time, which is tremendous and unusual in the same breath, but we'll continue now. I'm delighted to introduce Dr. Frank Huang Qi, who is the superintendent of the Kaixin Psychiatric Hospital in Taiwan. He has extensive experience in research that relates to community psychiatry, focused on issues relating in particular to disaster response psychiatry and suicide prevention, as well as forensic mental health services. He is a past president of the Taiwanese Society of Psychiatry and the current president of the Taiwan Society of Physical and Mental Health Promotion. His presentation is going to focus on how to improve service quality through the use of e-tools, but I think that Dr. Huang Qi is with us and may want to make a short introduction before his presentation is relayed to us. I think you may be on mute. There we go.
And can you hear me?
Yes. Yes.
Thank you. Thank you for your introduction. And I am Frank, and nice to meet you. Although we cannot face to face to communicate with each other. But I think this meeting can enhance our communication. So I have a topic, digital mental health framework, digital mental health service, and we tried to improve our service quality by e-tool. So in recent years, Kaohsiung Psychiatric Hospital to enhance our people the mental health, and we treat our psychiatric patients, also enhance our people's mental health. So we try to use e-tool to survey our people to find potential psychiatric patient, and if they have reached psychotic level, we can give her or his appropriate treat, including psychiatric evaluation, and offer mental health method, including exercise to improve the lifestyle improvement, and so on. So I will introduce this method in my topic. Thank you, everybody. Ladies and gentlemen, nice to meet you online. I am Dr. Zhou, Frank Wang Zhou. I am current superintendent Kaohsiung Municipal Kaixuan Psychiatric Hospital. I also as past president Taiwanese Society of Psychiatry. Today, I would like to present this topic, digital mental health service to improve service quality by e-tools. This slide showed the blueprint of 21st century community psychiatry in Kaohsiung metropolitan Taiwan, include long-term care and artificial intelligence. In the past, psychiatry service is based on hospital. So when a patient with psychiatric symptom, he or she call our OPD, and if he or she had severe psychiatric symptoms, they may be called our emergency room. Then, if their psychotic symptoms seem to be severe by psychiatrists, and the psychiatrist will suggest them enter to our acute wards or ICU. Then, if their psychiatric symptom will stable, they may be transferred to chronic ward. And if they are better, maybe they will transfer to rehabilitation ward or daycare. So, according to WPA's policy, all psychotic patients should be sent them to the community or their home. So we set up the Department of Community Psychiatry. Case managers will manage these patients stay in the community. For example, and these patients will stay home, but they will went to community rehabilitation center, or they maybe go to shelter plan or workshop for rehabilitation. Some patients will stay at home and they maybe not go back to hospital to receive the regular treatment in the OPD. So our case management, including psychiatrists or nursing staff, will visit them in their home. Psychiatrists will examine their symptoms and will examine physical examination, and our nursing staff will psychoeducate their self-care and teach their family how to care these patients. Another modern psychiatry not only to treat a psychotic patient, but also to enhance mental health and to treat many people with depressed or, for example, some people have sleep disturbance, anxious or depressed mood, and they will transfer from GP. So we will examine these patients and diagnose the name minor depression or sleep disorder, and give them some suggestion, including how to keep or improve their lifestyle modification. Psychotropic drug or benzodiazepine are not necessary in this stage. Psychiatrists will encourage them to keep a healthy lifestyle. For example, psychiatrists will encourage these people to do exercise every day, or to eat food or drink healthy, and to avoid high pressure, hyperlipidemia, or hyperglycemia. Is this condition, as we knew, drug abuse increased in recent days. So community-based psychiatry will also treat these substance abusers. In these substance abusers, some young adult, the number of young adult with drug abuser increased recently. So we also treat them at the same time. As we knew, natural disaster or man-made disaster seem to increase in this year. COVID-19 impact all the world.
So biological disaster may be addressed in this year. So we will counseling treatment and of disaster psychiatry are also be addressed. The aging people will increase in Taiwan. So long-term care should be addressed in Taiwan. As we knew, this trend seem to be in a global issue. So we set up long-term care ABC. What is ABC? A means case manager to treat these aging people with disabled. If they have any long-term care need, these case managers will transfer these disabled patients to be to fit suitable institution. B is similar to our daycare, but they set up in a community for disabled patient with some knee rehabilitation. So B is another daycare. The C is serve the elderly people or sub-health people for promote their health and delay their aging and the disabled processes. Because these people, the number of these people will more and more increased. So when we should evaluate these people need fast and effective measure. So to use e-tools for mental health service is an alternative choice. We try to establish comprehensive medical and caring system. In WHO said, health is the basic human right. So we performed national health insurance, health universal coverage of Taiwan. Another Taiwanese will be elder and elder. Maybe we need long-term care insurance, but until now, Taiwan has not long-term care insurance. But I hope we will grow in the future. To these two systems, we can use the e-tools or e-techniques. It means we can use information and communication technologies, ICT, to establish the comprehensive medical and caring system. For ICT or for artificial intelligence, let me introduce the brief the history and the development of AI. First weight and people use the logical and the symbolical reasoning, put human thinking logic into the community. The decision logistics are written by domain experts. However, it fails because human beings have not been able to clearly understand their own thinking process and how to tell computers. In the second wave, expert system put all human knowledge into the computer. The rule of experience are written by domain experts. However, how too many problems that could not be solved, cannot be written into rules, cannot be expressed in code. The third wave, machine learning, put all people's size into the computer. Domain experts provide historical data and let the computer summarize the rules by itself. We hope that it is successful. How we feel, how we thought, are closely related to the neural network. Artificial intelligence is similar to our neural network, which inspired maybe the human found cell therapy, neuropharmacology, neuroimaging, artificial intelligence, and so on. In humans' body, different genes are expressed in migrating neurons at various locations, implying the existence of missed signals or information along the migratory path. These details is still unknown. This showed traditional model and many energy and loss most. Quantum model like multi-path, and the transfer process is quantum considered such that the exciton travels like a wave. It can explore all possible paths simultaneously and only take the most efficient route west-east. So, what else can we play? For example, this is a hot spot. We use hotspot to detect people's work to prevent this patient or this people and this person fall down. Or we can collect many data to predict or prevent these so-called patients' violence behavior to decrease the accident. So, no data, no AI. AI is established under big data. So, data generalized, structurized, and unstructurized data. Big data, and then this data stored to perform the big data. Processes the data using CPU over GPUs and AI algorithms to detect the pattern. Predictive signals are generalized, actionable inside, and to perform the AI. Big data for the next AI generation. You can see this is traditional medical records by our doctors handwritten medical records. So when we relate conversion printed text, you can see this conversion printed text name, complete medical records in printing forms. You can see complete medical data in using printing forms. If you read this paper, it is clearly named these traditional medical records. AI in healthcare, the application, you can see AI and the robotics will be used in training, keeping well, early detection, diagnosis, decision making, treatment, and of life care. In the future 2 to 5 years, 5G IoT will enter to our life. We can use devices. We can use the video, 5G internet, RFID, and data set, data bank, and so on. And how we work, bionic quantum neural network, research object, investigation, named machine learning. If you have theory, you can use the machine learning experiment and produce results. That's some Neuralink architecture today, and this is a small and focused. Research object, medical neuron, physiological data, theory, like physics, open quantum system, chemistry, photo-induced fluorescence, machine learning, AI, and CNN, experience. These results could be a creation of new field, biomimicry application, novel medical treatment, new tools for machine learning, new tools for measurement, new tools for fabrication, new industry, and so on. WHO highlight health management. WHO predict until 2020, the global health resource will have 20% put into our health promotion in smoking, alcohol drinking, malnutrition, inadequate exercise, obesity, high blood pressure, diabetes mellitus, hyperlipidemia. All of these are most based on inadequate lifestyle. So lifestyle risk should be addressed in health promotion as well as mental health promotion. In the past, and this is a manual, you can see we need code or when to hospital if these people have some problems or some symptoms. However, they may be fine, or they be just temporary the imbalance. So just call the doctor, and the doctor is named name by using the lab data or S1, S-line or EKG name, tell these people you are okay. However, in the future, these people will stay in home to receive the first screen, and if they still have some problems, this patient will be arranged to call hospital and receive the physicians to be diagnosed or examined in the hospital. So we need to establish the network platform. Internet of Medical Things 3-in-1, including medical technology, information and communication technology, service model. In our hospital, we try to combine with big data and apply the AI machine learning to predict dementia or depression the probabilities, and to offer prevention and treatment for our citizens. Summarized, Health Internet of Things service. These items include the cloud health record, statistical analysis, trend chart, health management platform, people's self-management, professional consulting for health managers, multi-specialty team consultation, psychological family doctor, nutrition, social worker function, health prescription, health internet, include food, clothing, housing, transportation, education. The combination of Internet of Things, mobile internet, big data, cloud, and so on has inserted the winds of wisdom for health management. It will be able to achieve the long-term tracking and the real-time monitoring of health management, obtain more complete information, and perform the health assessment more accurately, carry out health intervention in time, and finally, provide the public with personalized health management services. And this is Chinese version in the previous slide. Okay, and this slide shows the shifting from reactive, proactive, and predictive care. Okay, the application of information and communication techniques. The people will use the mobile phone or plate to download app, and this app combined with hospitals. So patient self-management free to get and use app to get in-time medical information, help for self-monitoring, prevention, and treatment. This is a mobile phone and the download app. Mobile possibility. Name smart clinics in the hospital, teleconsultation, teleconsultation instead of face-to-face consultation. Diagnosis information platform. MC HIS Cloud Scope, OPT-ER IPD. This is Chinese edition platform service system. In this slide show our computer and the big data the management, it was applicated in community treatment and the long-term care. When inpatients are treated stable and they may be discharged in a few days, case manager will use this system to transfer them to home care, community rehabilitation system, refer them to halfway house, or refer them to nursing home, or they may be go home directly, and our case manager will visit in the future. And all this data are put into our platform big data bank named machine learning, and to perform the AI. For example, I will tell you a real example and theory. When one are born to the world, they maybe have some problems for genetic factors, or they have family problem and interpersonal relationship, and these stresses may be increased and may be severe. Suddenly, major risk factors impact this patient. Maybe they have used suicide, or they may be burned out and sent to hospital for further treatment. So if they suicide, how to present or how to early detect these people with potential suicide? We can use the first screen. We can use the teleconsultation, and this shows if they have suddenly exposed a significant impact. As we knew, most people have varied psychosocial stresses. However, if this patient and these people are good in the past, they may be received consultant and to keep the health life. When this minor stress disappeared, they go back to normal life. However, if these major they maybe have major psychosis. However, when this major psychosocial stress disappeared, for example, earthquake or this COVID-19 impact disappear, most people will return to normal stage. But some minor people will stay in psychotic stage, so they need to be treated or be followed up longer. So we used first mental health screen tools to screen our people. I transfer this data into English version as this, and the validated of DRPST are were published in Australia and the New Zealand Journal of Psychiatry in 2003. This is first screen tool, English version. Okay. However, this screen tool, the words are small, so we put this scaled into the website for health promotion. We put in this data, the words are larger. How to use these e-tools? First, apply for membership, name, psychological counseling, and written informed consent. Write personal information, name, to perform the first screen by himself. This is to evaluate their exercise or food and drinking habit. The same. Okay. When the people performed this first screen, name, this data will transform to summarize the report, including best information and their lifestyle evaluation, and including eat and drink and exercise evaluation, and tell them how to treat their psychosocial stressors and their quality of life. Another, this first screen tool also summarize their traumatic scores and sleep disturbance and depression scale. At last, we also teach our citizens to perform the mental health promotion life. We said 5Q New Life. What is 5Q? Living quality, lifestyle management. As we knew, sleep early and wake early and exercise regularly and eat health, drink health, reduce smoke, reduce alcohol, keep lifestyle easy, simple, and well. Another, we can emotional control and change our cognitive. Another, we also exercise every day and read book, read the relative knowledge to increased our problem-solving ability. So we can have many resilience to prevent burnout. So psychophysical health skills, machine and the computer name produced report and the health passport. If some people have some problems, we will telephone counseling by health managers. In the last, I will introduce our hospital. Our hospital, all building, and in the future, our new remodel building will established in the next year, 2021. This is our hospital in the 2021, and other long-term care institution. Thank you for your attention. Ladies.
Well, I think we can all agree that that was an absolutely fascinating presentation from Frank, with some real examples of innovation and development that are happening in his hospital and within his service that are really having a direct effect on the way in which people can access services, receive treatment, receive screening, and efforts that are really being used to tackle, for example, incidents of depression, reduction of suicide, but also striking that really important balance that we've heard about throughout our discussions today so far of public mental health and promotion and prevention alongside treatment. So, Frank, thank you so much for that really enlightening presentation. I'll take the opportunity just now to remind colleagues who are on this call that there is an opportunity to ask questions and engage in a short discussion towards the end of our call today. We'll have about 15 or 20 minutes to do that. So if you have any questions, do please post them in the chat, and I'll do my best to put them to colleagues who are still on the call towards the end of the session. In order that we can hopefully keep the time, I'll move us on to our final presentation, and I'm delighted to introduce Dr. Kawisak Suritraka, who is the Director of the Office of Information Technology at the Department of Mental Health in Thailand. And he is going to share with us the work that has been undertaken within the department to address the use of digital mental health services in Thailand. Kawisak, over to you.
Good morning and good afternoon, ladies and gentlemen. It's a pleasure to have you with us today. I am here to talk to you about the digital mental health service in Thailand. The objective of the topic to update the progression of digital mental health services in Thailand and to share experience and knowledge about digital mental health services developing. I just like to give you some background. In public sector, there are 20 psychiatric hospitals in Thailand under Department of Mental Health spread across the country. 6 of 20 hospitals are subspecialists in child and adolescent psychiatry, but these are not enough